Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, it's another show, and I want to talk about caring and sharing. And that means that I'm so proud of each and every one of you for all the communication that you're sending my way. It lets me know what exactly is happening out there as far as your health. Remember, www.medmoments.com. That's www.medmoments.com. Don't forget the S. And you can tweet me also at MedMoments. Alrighty, remember, our health is the most important thing that we have. And it's so important that we are educated consumers of health. That's what this show is all about, educating all of us so that we can take better care of ourselves. Tonight, we have an excellent show. We're going to talk about the topic of pneumonia. And I have the perfect person to talk about this particular topic. His name is Dr. Christian Engell, and he is an infectious disease specialist. Dr. Engell, welcome to our show.
Thank you so much.
All righty.
It's such a pleasure.
Well, I'm glad you're here because I'm so glad you extended your time and came on and would come over and allow us to interview you for this most important topic. All right, pneumonia. I'm going to start with my basic question, and I start with this question.
Great.
With this particular question with everybody. What is pneumonia?
Well, pneumonia is when germs infect the lungs. Germs like virus and bacteria. They get into your lungs and they can make you sick.
Oh, all righty. Now, when you say get into your lungs, is it like traveling down a highway and you just all of a sudden open the door and walk in, or is it really is it difficult for the bacteria and the viruses to get in there, or is it easy? Is it easy to catch pneumonia, or is it a difficult process?
Well, usually when people are walking down the street and they get something in their air pipes going down into their lungs, they cough and they bring it back up. Right. But sometimes they encounter a bad germ that can actually bypass the body's defenses.
All right. So what you're talking about is some germs are good germs, and some germs are bad germs. You understand what I'm saying? There's good bacteria and bad bacteria, so the bad bacteria actually gets to the lung.
There are especially bad bacteria that can infect everyone, but usually people with weakened immune systems or people who are older or young kids.
Oh, all right.
But any one of us can have pneumonia if we're so unfortunate to meet a particularly bad germ.
All righty. Now, when you talk about pneumonia, are you talking about the infection actually taking over the function of the lung? Is that what we're talking about, or is it just the bacteria is overgrowing, or what's actually happening at that lung at the tissue level?
Well, the bacteria get into the lung, and the body tries to attack the germs. And what that can do is it can make you very sick. It can make you short of breath. Because the bacteria, in essence, can destroy the lung tissue.
Oh, all right then. So it's actual destruction at times.
Absolutely. It can be very severe.
All righty. Now, as far as I know that we can get pneumonia, but can we really get rid of it? You understand, like it's not like an ongoing disease. Once you have it, there's a trace of it always left. Do we really get rid of it?
Oh, absolutely, absolutely. With most types of pneumonia can be treated with antibiotics. And if you have the right treatment for your pneumonia, it should get better in about 2 to 3 days.
Okay, all righty. So that's a pretty short course, all righty. Short illness, 2 to 3 days.
Well, pneumonia can last a lot longer. You start to get better in 2 to 3 days, but sometimes it can last 2 to 3 weeks until you're fully well again.
Okay, all right. What are the symptoms? How would I know I had pneumonia? I'm walking around and every day and I'm, feeling normal. What would happen to me? What would I experience that would let me know that I may have pneumonia?
Well, it can start off with fever or a cough. You can actually have chills, teeth chattering chills. You can have rapid breathing. You can feel that you're short of breath, that you can't catch your breath. Sometimes you can have nausea. You can have chest pain every time you take a deep breath. And sometimes you can even have diarrhea along with your pneumonia.
Okay, all right. So that means that every time you try to take air in your lung is like yelling and screaming and rebelling.
Ow, ow, ow.
Ow.
That's
There you go. There you go. I understand. Now, I know that there are many types of pneumonia. Can you give me an idea the differences between the different types of pneumonia, like maybe viral or bacterial or?
Well, usually we actually talk about regular pneumonia, which is also called in doctors' terms community-acquired pneumonia, and that's the type of pneumonia that most people get when they're walking around. You can also have hospital-acquired pneumonia, which is a pneumonia that people get in the hospitals. When it's very severe, you need to go in the hospital. A lot of pneumonias aren't so severe. Some pneumonias, you only have maybe a little cough and a little fever, and your doctor sometimes calls that walking pneumonia.
Okay. So you're actually out there feeling like you have a bronchitis or something.
Exactly.
Maybe a little sweats or every once in a while or something like that. No real chest pain, just coughing. Oh, it'll go away, but you actually have pneumonia.
Absolutely.
All righty. Can you die from pneumonia?
Unfortunately, yes. Pneumonia, especially pneumonia caused by germs that are called bacteria, can be deadly.
Okay.
Absolutely. So we take pneumonia very seriously. And if we have a patient who has pneumonia, we generally treat them with antibiotics.
Okay. Now, I understand that the lung has different components. It has different parts. Is it possible to have pneumonia in more than one area of the lung?
Well, the more of the lung that's infected, the more serious the pneumonia generally is.
Oh, okay. All right then. So the shortness of breath is worse?
The shortness of breath is worse, the fevers can be worse, and your risk of dying can frankly be increased if it's very extensive pneumonia.
Question, should everyone who has pneumonia, should all of them go to the hospital and be treated?
If you are very sick and have very high fevers and you can't catch your breath, you should go to the emergency room immediately.
Right.
However, if you're not that sick, you should call your doctor first. So it's the safest thing. If you're extremely sick, weak, you can't stand, you're lying in bed, then you have to go to the emergency room. But if you're coughing, maybe you don't even have fever, then I would go to my private physician or my local medical clinic for assistance.
Okay, all right. Does seasons matter?
Oh, absolutely, seasons matter.
Okay.
Because in the wintertime, there is a lot of influenza, which is a virus that also can cause pneumonia. But what's worse is having that virus causing pneumonia puts you at increased risk for having a bacterial pneumonia afterwards.
Oh, wait a minute. You mean I get a virus, the virus goes away, then the bacteria moves in?
That's right. And that can be quite severe, especially because if we have a virus, our body can be very tired after putting up with one infection. And then when the next infection comes, it can be quite serious.
Okay, all right. So when I was a child, and my grandmother used to say, "Boy, come on in here before you catch your death." That's what she was talking about. You know, I'm outside playing in the rain. She's like, "Get in here before you catch your death," because pneumonia. And back then, pneumonia was a very serious, and it's still a very serious.
Well, back then, there weren't that many antibiotics to choose from to treat the pneumonia. So the best way to do well was to avoid getting pneumonia.
Right. I understand. All right. What about as far as age is concerned? I know that maybe very young or very old, I know for other diseases, it really matters. Does it matter with something like this?
Oh, absolutely it matters. The very old are at increased risk for pneumonia.
Okay.
And so are the very young.
Right.
So they have to take extra care to try to avoid getting pneumonia.
All right. So that means that mothers, when they're out with their babies and they're walking, they should make sure that they're covered up and make sure they have the proper clothing, those type of things.
Absolutely. It's so tempting for me when I see a baby in the mall or on the street to go up and touch it if I know the parent. but I try not to because I don't want to spread my germs to the baby, especially if it's a very young baby, a couple months old or 1 month old.
Right, right. And as far as seniors are concerned, do they always demonstrate the symptoms that maybe someone else may, you know what I mean, a younger person would have?
No.
Cough and shortness of breath, that kind of thing?
No, they don't. No, they don't. Sometimes the elderly in our population, the only symptom they have is just feeling incredibly weak and tired and run down, and they may be a little short of breath. They may not cough as much, they may not have as high fevers, but they can still be very sick.
Interesting, interesting. Now, you said that the pneumonia can hurt the lungs. I mean, what does it actually do to the lungs? Does it, you said something about a cavity. Explain what a cavity is.
Well, pneumonias can actually, when they're very severe bacterial pneumonias, can actually cause destruction of lung tissue. So the lung actually develops what really is a ball of pus. A ball of infection, and when that ball drains, you actually see a hole in the lung, what we call a cavity.
Oh boy! All right. Yeah. So does this cavity ever go away? Can we regenerate the lung in that cavity and try to, do better for our breathing? I'm sure the breathing is affected.
It certainly depends on the size of the cavity. That's certainly. But many times a cavity can remain after the infection has passed.
So the rest of your life, you're going to have a hole in your lung?
In some cases, yes.
Wow. All righty. Okay. All right. Now, other illnesses that may make you prone to infections and or pneumonias. What are some of those other illnesses? One pops up like diabetes. I would assume that
diabetes absolutely increases your risk of pneumonia. So does heart disease or any other type of lung disease. If your immune system is weakened by HIV, AIDS, if it's weakened by cancer, you're also at increased risk for pneumonia.
Right. So that just means that you can't fight the infection off. Your body's just weak. And
exactly. So not only are you at increased risk for getting pneumonia, if you do get it, it can be much more serious.
Oh, all right then. All righty. Now, I know that that TB is something that's out there. Is TB a pneumonia, or can it be a pneumonia as well?
Absolutely. Absolutely, TB can be a pneumonia. And what makes TB different from other types of pneumonia is that the course can be very long. So TB patients that I see have many times been coughing for many weeks, with fevers for many weeks. And it gets worse and worse and worse. They may even have gone to their doctor for antibiotics that didn't really help them.
Right. I understand. Now, in your particular office, all right, how do patients present? I mean, if you know what I mean, as you being a physician, you see many patients into your office. I'm really sure they're like antennas that go off that this person may have a pneumonia. How do they present to your office?
They look miserable. They have a fever usually. They are coughing. They might bring up some yellow or green mucus when they cough. They can be short of breath. And they often complain of some chest pain. And they just don't look very happy.
All right. Can you give someone else pneumonia? Meaning that if I have it and I cough on you, I give it to you?
Absolutely. Absolutely. A lot of pneumonias are very, what we call transmissible. It's easy to give them to another person. Viral pneumonia from influenza can be very readily passed from person to person. Tuberculosis pneumonia that you mentioned before, TB pneumonia, can also be passed from person to person. So staying away from people, especially during the seasons like the wintertime when there's a lot of pneumonia that are coughing, is probably a good idea. And reminding your loved ones to cover their mouths when they cough is probably also a good idea.
All right. What about things like washing your hands after you cough and stuff like that?
There are a lot of things we can do to prevent pneumonia. And washing our hands is probably the #1 thing we can do. Trying to stay away from people who we know are sick, especially if we have a weak immune system or we have diabetes like we talked about before, is also a good idea. And probably just as important, it's important to get vaccinated.
Oh,
I mean, there are several good vaccines out there that anyone's doctor can talk to them about that can prevent or at least reduce the chances of getting a pneumonia.
Okay. Now, I know influenza vaccine is a big thing. Every year they're talking about this all over the place to get. Who should get the vaccine? Should everybody get a vaccine or only those people that are at increased risk to pneumonias?
Well, it's always a good idea to be vaccinated if you're at increased risk.
Okay.
So if you're elderly, if you have chronic conditions like heart disease, like lung disease, in the young, we vaccinate people for pneumonia also, or influenza rather. There's also pneumonia vaccine that vaccinates people against the most common cause of pneumonia.
You mean like bacterial problems?
Bacterial pneumonia.
All right.
And that's also very important to get vaccinated for, especially if you have a condition that makes you at increased risk, like being over 65, like having diabetes or HIV or heart disease or lung disease.
Now, how often should you be vaccinated?
Well, for influenza, as I'm sure many of you listening know, it's every year.
Okay.
That's really when you should be vaccinated for influenza. However, for pneumonia, you only need to be vaccinated once or maybe twice, depending on the condition that you have.
Okay, all right then. All right. Can you give me some idea what's the difference between bronchitis and pneumonia? Because I know sometimes I can get a cough going and it seems like forever, and I swear I have pneumonia. How do I know I have pneumonia as opposed to bronchitis?
Well, unfortunately, sometimes you can have both at once. But what bronchitis is bronchitis is infection of the airways that go to the lung.
To the lung tissue.
To the lung tissue.
Gotcha.
And pneumonia is infection of the actual lung tissue. So sometimes a bronchitis can become a pneumonia.
Okay.
And sometimes you can have both the airways and the lung tissue involved. Generally, pneumonia is much more serious than bronchitis.
Boy, oh boy. All right, so you can actually have both. All righty, all right. I know that pneumonia is a part of the lung, and I'll put it this way, it's an infection, from what you state, in the lung tissue. Now, there is something, I know sometimes that they say the lung, when it's infected, it weeps and the fluid builds up. Why does that happen? Why does there's fluid around the lung and then you get short of breath? Somebody was telling me about that.
That's a very good question. What really can happen in some types of pneumonias, especially bacterial pneumonias and tuberculosis pneumonia, is you can have fluid around your lungs. And even after you give the patient a course of antibiotics, that fluid can stay and present a problem. And so that's sometimes you have to go back to your doctor and really, sometimes a doctor will have to actually remove that fluid. That's rare, it's not common, but it can happen.
So he has to actually put something in your chest.
Put a needle in and remove
that fluid
to make sure there's not infection in the fluid.
Interesting. So that you can get infection in the lung tissue.
Exactly.
And the bacteria can seep out into the fluid.
And then that gets infected. And the antibiotics have a tougher time treating that lung fluid, so you can end up in a position where you've treated the pneumonia, but now you have an infection in the lung fluid.
Interesting.
And that's a problem.
Now, how does the bacteria get to the lung? I mean, I'm assuming, you told me that you can inhale it, but are there any other ways that bacteria can get to the lung or viruses can get to the lung?
Absolutely. So inhaling it is very common. What can also happen is if you are sleeping or if you're sick, for example, if you're vomiting, you can actually aspirate, which means you can breathe in some of the secretions in your mouth or some of the vomit actually, and that can give you quite a significant pneumonia. You can also get pneumonias from the bloodstream. So the bacteria can enter from another point in your body and then go to your lungs.
Interesting. So if I cut my finger or something and it gets dirty and the bacteria gets in there or something, however it gets into my blood, it can actually travel through the bloodstream and go to the lung and infect my lung?
It actually could. I think that's really a rarer cause of the pneumonia, but it could potentially happen.
Interesting. All righty. Now, I wanted to know exactly, as far as pneumonias are concerned. I know sometimes in my practice, I see patients come in and they don't really look feverish, they don't really look sick, and then I do maybe a chest x-ray or something like that. Mm-hmm. Tell me in diagnosing these particular diseases, or this particular disease, what are the methods that you use as a physician to really know what you're seeing, or really know what you have there as far as the pneumonia, the type of pneumonia, and to know what type of treatment that you would go from there?
Well, generally, when someone is not very sick with pneumonia, mm-hmm. we don't do that many tests.
Okay.
But when they are sick, we generally start with a chest x-ray to see whether we can see the pneumonia mm-hmm. on the x-ray. And sometimes we also ask people to have some blood work done that will also give us an idea of whether the patient is infected. Mm-hmm. If you're very sick and you require hospitalization, then sometimes we can do some more advanced tests to try to help the patient and diagnose the problem.
All right. So some of those tests, just to give people a flavor, would it be like a CAT scan or an MRI or whatever? I think some of these fancy names.
We could do a CAT scan sometimes. Mm-hmm. Sometimes people need a bronchoscopy where they actually have to take a camera mm-hmm. that goes into the lungs and take samples of what's in the lung to try to identify what's causing the pneumonia.
Okay. And that way, you as a doctor, you can prescribe the right antibiotic for that particular bacteria.
Absolutely. And that, in the end, for all pneumonias caused by infection is the most important thing, to be put on the appropriate antibiotics as early as possible.
I got you. Now, what about as far as you talked about community-acquired pneumonia. I just want to go back on that one just for a minute, because I understand that that's a broad kind of, that's the most, what you said, it's the most common type of pneumonia?
Absolutely.
Now you mean it's bacteria that's just out there in the community, or is it, I will get it from a special, I have it for a special reason. How does that play?
Well, there are bacteria out there in the community, mm-hmm. and you can certainly, anyone can get a community-acquired pneumonia. Okay. The chances of you getting are obviously greater if you're a smoker or have any one of the conditions that we talked about earlier that weaken the immune system. Mm-hmm. So it's important to quit smoking, for example, but anyone can really get a pneumonia. And the most common germs that cause this are bacteria.
Bacteria, not the viruses.
The viruses, certainly influenza, the flu can cause it too, but the mm-hmm. bacteria are usually what we refer to when we talk about community-acquired pneumonia.
Okay, now tell me about the viruses again. Do we need antibiotics for the viruses?
Absolutely not.
Okay.
Absolutely not. Some people may need some antiviral medications, which are antibiotics for viruses if they have the flu. But usually people don't need any treatment of their viral pneumonia.
Okay, all right then. Now, how does the body, I know with smoking, and there are certain little hairs that are along our airway that help keep the bacteria flowing and stuff like that. And with smoking, you burn these little hairs off, and then you're more prone to bacteria. But how do we combat that? I mean, not combat it, but how do we help that along? Because there are just so many smokers out there. What can they do? I know they could stop smoking, but is there anything else they could do to prevent pneumonias from coming about?
If you are a smoker and you smoke a lot, and you don't want to quit smoking, which is really the number one thing you can do, there's no question about that, then you should certainly think about definitely getting your vaccinations.
Okay, all right.
And washing your hands frequently when you're out in public.
Okay, all right, then that's good. Now, as far as treatment is concerned, most of the treatments are antibiotics, as you were stating. Are there any other type of treatments or anything that we can do to better ourselves as far as preventing this from happening?
Well, if you do get pneumonia, mm-hmm. then antibiotics is the first line. But especially in asthmatics mm-hmm. and people with chronic lung disease, using inhaled medications to help you breathe better, mm-hmm. what we call bronchodilators, can be very helpful.
Okay.
You can also use cough medications to reduce the amount you cough. Right. Again, you should talk to your doctor before using those cough medications, but mm-hmm. many times they're helpful in making us feel better.
Excellent, excellent. Well, this has been a great topic. I'm so glad you covered it for us.
Thank you so much. It was such a pleasure.
Glad you could come. Thank you very much. Thank you very much,
you.
Dr. Engell. All right. So we're going to come to our next segment, and this is our Let's Talk segment. And today, I would like to ask you, are you planning a family? Are you pregnant? Are you still smoking? Well, let me tell you, if you are, there is a chance that you may be hurting your unborn baby, number one. Number two, you may be hurting yourself as well. And the only way that you can prevent the harmful effects from smoking towards the baby that you carry is to stop smoking. For quitting smoking, it lowers the exposure of harmful effects to your baby, number one. It increases the amount of food and nutrients that your baby will get. It lowers the risk of what we call stillborn, or babies that may be born dead. And it allows you to increase the chance of having a normal or a healthy baby. Alrighty? And as far as you're concerned, well, it does things for you too. It lowers the risk of you getting cancer, as well as heart disease, as well as lung disease. It lowers your risk for reproductive problems. And it can help your breathing. Of course, if you stop smoking, it's going to help your breathing. But the most important thing that it does is it sets a good example for your baby once it's born. After the baby is born, continue not to smoke. It sets such a good example for your baby. Alrighty, guys. In closing, remember, caring and sharing. www.medmoments.com. Email me, tweet me. I am so happy to get all of those emails and tweets just to know what's going on with you out there. Never institute any change in your medical therapy. I trust that each and every one of you continued good health. Until next time, peace to you all.